Hello, everyone. My name is Narane, and I'm going to be talking about health issues and healthcare in prisons today. United States is going through a situation called hyperincarceration or mass carceration. This term means we have a massive amount of individuals getting arrested, and this issue causes the prisons to overpopulate. Health issues come with overwhelmed incarceration facilities, which can spread to a bigger crowd and even get to outside world once the incarcerated individual gets released from the facility. Tough on crime is another term related to this condition, meaning to treat all criminals as harshly as the law allows, and as a result, inmates sometimes get maximum sentence from the judge. Tough on crime happens more on drug possession crimes. Over half of state prisoners and almost 90% of jail detainees have drug dependency problems. Hepatitis C is 9 to 10 times more chance of happening in the prisons than communities. Chronic health conditions like asthma and hypertension and mental illness as well. Healthcare isn't as important in these facilities. As a result, inmates who return to home, which is 95% of them, take their health issues with them to the outside world. Mental health disorders. In the 1970s, psychiatric hospitals began to use more humane care methods to treat their patients in the communities. This resulted in releasing patients hoping that being with their families would heal them faster and better. This caused massive amount of incarcerations due to mental dysfunctions. Some locations have a higher number of cases like Chicago's Cook County Jail, New York's Rikers Island, and Los Angeles County Jail. As far as drug dependency, over 50% of inmates have drug dependency issues. One in five state prisoners has an injection drug use history. Up to a third of all heroin users, which is approximately 200,000 people, are found in prisons and jails. 70% is the number for drug abuse in prisons, and for general population is about 25%, which is a huge difference. As far as infectious diseases, we can look at tuberculosis, HIV, STI, and hepatitis C, which are among most seen illnesses in correctional facilities. In 2002, jails had 17 times and prisons 4 times more prevalence of tuberculosis than general population. The prevalence of sexually transmitted illnesses are higher among female inmates due to matters like prostitution. Chronic conditions are conditions like diabetes, asthma, hypertension, and they have two reasons of happening. Aging of the prisoners and nation's obesity issues. And also 40% of inmates have at least one chronic condition in their lifetime. So my recommendations for fixing these issues are lawmakers should focus on correctional healthcare more because it affects the inmates and their loved ones once they're released. There should be screening and checkups for any health issues upon arrival during the time of their sentence and when they're released to make sure there are no health related complications. There should be nurses and doctors on site 24/7 and not only on call for the emergency incidents. As far as mental health, drug abuse programs should be offered for whomever would like to take advantage of them. This could help educate the inmate on their issues and encourage them to seek help. Providing counseling is a beneficial option as well, since it could possibly prevent suicidal thoughts, which is one of the causes of mortality in prisons among top 10. Another one would be correctional facilities should be given a stable budget to work with because most of the issues mentioned can be resolved with some funding. And lastly, correctional facilities should make sure they are getting the inmates ready for their release. Most of the time, inmates leave the facility without any clue how to adapt to the outside world. And according to the chapter 19 of our textbook, one issue individuals with mental disorder face is housing. If mental issue can be fixed or the severity can lessen, it would help them to be more stable and be able to communicate with others. Not having housing also leads to homelessness, which comes back like a chain reaction. Thank you for listening.